Hello, I'm Dr. Martin Bergman, Clinical Associate Professor of Medicine at Drexel College of Medicine and a member of T-Reg. I'd like to take a few moments to talk to you about gout. Many of our patients don't fully understand the treatments for gout and are too often willing to treat frequent flares with symptomatic medications without ever realizing that there are better and more lasting treatment options available to them. A way that I've found helpful in getting my patients to understand is to compare gout to a boiling pot. From time to time, a boiling pot will boil over and spill out onto the stove. This is basically a gout flare. Once this happens, we treat it simply by cleaning up the mess. In the case of treating gout, this may be done with nonsteroidals, prednisone or other steroids, joint injections, colchicine, ice, analgesics, frankly whatever works. But once the mess is cleaned up, we still have the issue of the boiling pot. Another thing we can do is to put a lid on the pot. This is what we call prophylaxis. We want to prevent the pot from boiling over and making a mess of the stove. Most of us will use colchicine or nonsteroidals for this purpose. The prophylactic medications, however, need to be taken on a continuous basis, at least initially, or at least until the pot has come to a point where it is no longer boiling over. However, as we all know, even when a pot is covered, it can still boil over and make a mess. So rather than just putting a lid on the pot, the best approach would be to turn down the heat. In the case of gout, the heat is too much uric acid in the body. The way we reduce the heat is to reduce the uric acid burden. For this, we use uric acid lowering agents. Most rheumatologists will start with an agent that blocks the production of uric acid, such as allopurinol or febuxostat. However, these aren't the only agents currently available. Others will try to increase the amount of uric acid that's eliminated through the kidneys. Historically, probenecid was used for this purpose, but now there is a new agent, lesinurad, which has been shown to work in patients who are on either allopurinol or febuxostat, but continue to have an elevated uric acid level. Finally, in some cases, when the uric acid level is particularly high, it's necessary to reduce this by dissolving the uric acid out of the body, and pegloticase can be used in this situation. In each of these situations, though, the goal is to reduce the total body uric acid level to an acceptable range. For most of us, this range is generally felt to be less than 6.0 milligram per deciliter. However, in patients who have tophi or have particularly high uric acid burdens, a lot of us will feel that this should be a lower level and will target closer to 5.0 milligram per deciliter. But it's important to remind the patients that gout flares tend to occur when we are lowering the uric acid levels, so it's important that they remain on their prophylactic medications until the final uric acid level is attained and is stable. At that point, the pot is no longer boiling, so the lid, that is the prophylactic medications, can be removed. The uric acid lowering medications, which are lowering the heat, will need to be continued indefinitely. Remember, once the heat is turned back on, that is the uric acid is allowed to rise, the likelihood of having a recurrence of flares is virtually guaranteed. I found this to be a good way to explain the different levels of treatment of gout to my patients. Of course, any discussion of medication should also include the safety risks of that medication being used. Still, I hope this gives you another way to discuss gout and its treatments with your patients. Thank you.